One of the number one things we see here at Rejuve is chronic knee pain. Whether it be arthritis, you had an old sports injury, you've possibly had cortisone injections in the past and they didn't work well for you, or they're no longer working for you. You've either had surgery or maybe you've contemplated surgery. You're looking for other options, and we have those here for you. So pain number one comes from nerves. One of the things that we can harness here at Rejuve is actually targeting those nerves around the knee. Particularly, we have some on the top and underneath the bottom here. We can inject directly into the area of the nerve, offsetting some pressure, increasing the health of that nerve, and it can decrease knee pain quite significantly, and is quite efficient for most people. We also look at steroid injections. So we use a very, very minimal amount of steroid when we do injections here. Just enough that it breaks down some of the inflammation, but doesn't cause the breakdown of the joint of the health. And that could be why that cortisone injection used to work, but now it doesn't, because it's actually broken down some of the cartilage, some of the protective mechanisms within your knee. We use about 1/10 of what they use in most places for injections. And when we do our injection, we also inject some of this medicine that's going to help calm down the nerves within the joint as well. One of the other components of steroid injections or cortisone injections into the knee is, did they actually get to the right place? We don't do blind injections here at Rejuve. We're either going to use ultrasound guidance or fluoroscopic guidance, so a live x-ray that can tell us that we are for surely within the knee. That can make a huge difference. If you don't get the medicine where it needs to go, you're not going to get improvement with that medication. So that's one of the other big things that we can do here, or that we do here frequently, that not everyone else does. Kind of another step down the injection route can be hyaluronic acid, or a lot of people used to refer it as a rooster comb injection. So we actually go inside the knee joint, we put in this visco supplement, or kind of this thicker lubricant. It's kind of like putting extra grease into the knee. So when you've worn down your cartilage components of the knee, the meniscus isn't working as well as it used to, or maybe you had it removed from surgery. Now those areas are grinding against each other. We can put in this visco supplement, so then it's not quite as grindy. Get a nice smooth surface over those chondral or the joint surfaces. Once we calm that down, a lot of times that can help decrease your pain a little bit more long term. Can postpone other procedures that you may need to do in the future. One of the other injection techniques that we use here is either prolotherapy, PRP, or stem cells, or a regenerative line. So that's one of the ways that we can avoid surgery here. Those medications go in and they harness our body's ability to inflame, and it puts all the proper products right in the place that they need to be. You're going to create a healthier knee by increasing some of that cartilage within the knee. You're going to increase the stabilizing structures in the knee, so it's not wobbling around quite as much. It's going to be nice and solid. So those are all of our kind of injection type things that we can do, kind of focused in our orthopedic clinic. But on the other side of things, we have physical therapy. One of the most common things that I prescribe is physical therapy, because for almost any joint or any pain that you're having, if we can really focus on the stabilizing muscles, the soft tissue in the area, increasing your strength and your proprioception, or your body's awareness of where it is, we can really increase the likelihood that knee pain is going to get better. We couple that with some of those injections that we can do. You can decrease your pain, you can be more productive in physical therapy. And let's say that you have 10 extra pounds that you need to lose or more, then that decrease in pain is going to increase your ability and your confidence when you go out there and you try to exercise more, or you want to do your physical therapy exercises. You're going to have more success. We also focus on your nutritional components. So if you eat well, your hormones are in balance, we're doing physical therapy, we're doing some other injections, we look at the whole body and kind of put it together to increase the likelihood of success of procedures on your knee.